Good afternoon, and thank you, Dr. Andrews, for the invitation. And after fitting and selling all these things, the main problem we faces is some patients will come back with uh, some complaints. They won't be able to tolerate it. Please, can increase. So, okay. Spectacle intolerance is not that rare, it is common. It is the biggest insult. Sometimes the patient will come and tell you that my earlier spectacles was better than this. Then it is difficult to manage it. And with introduction of these progressive lenses, this type of problems are go on increasing. At least around a good number of patients will have all these problems, maybe due to the refraction problem, dispensing problems, and communication. That comes a big chunk of all these problems. Then acute ocular diseases and psychological problems. Usually an average of 6% of people will have problems due to different reasons, like a heavy frames, they don't like it. Sometimes the near vision is too high or too low, frames not fitting properly, fogging of the lenses. So all these problems are not very rare, and distorted images, pin cushion, all these problems you have to see. But the main thing is you have to prevent this one. So always to have a good history, even if you are taking or you are refractionist, should take the history properly. The occupation is very important, and careful refraction, as Dr. Sarsam sir has explained, careful refraction is very important. If your refraction is wrong, that patient is not even going to come for your cataract surgery, or they are not going to attend your hospital. So refraction is a very important point. End of the refraction, you should instruct your refractionist also and to change to their old glasses and ask them whether this is better or the present refraction. That's a must for every case, and you have to discuss with the patient. Wrong prescription is another thing. Sometimes it will be an inadequate cylinders detected, and incorrect or decimals or plus or minus signs differences, all this thing comes. Then coming to the fitting things, you have to be very careful. You should have a very good fitter if you are having an optical shop, or even otherwise if you are patient going out also, you should instruct that there should be a good fitter, and you should take the IPD reading in every cases. This will be useful for the frame selection, lens adaptation, and frame and lens final adjustment. IPD can be measured in different ways, but a good optician, he will measure it without much instruments. We can put the frame and he can mark it very well. And distance between the inner canthus and outer canthus. And there are many methods. There are so many instruments now available. Even in auto refractometer will be giving you a good reading. But every time you have to remember, it is not the IPD icon. Each eye should be measured separately. And ideally, you have to put the selected frame and you have to measure it over that. Frame must be comfortable. Lenses should be perpendicular to the visual axis. Again, you have to think about it. Say, Dr. Andrews has shown so many frames and so many things, and patient has to select. Patient has to be comfortable with this thing about the bridge size and everything. You have to advise it. Frames should not rest on the apple of the cheek, should not cover the eyebrows, and round frames in astigmatism you have to be very careful. Not like I think it's nowadays is again coming back with the Gandhi frame, so you have to be very careful about fitting, because cylindrical power, you can rotate it. Vertex distance, especially in high errors, is very important. Lenses, try to fit lenses at the anterior focal point should be large enough to give good visual field, and vertex distance is very important. Sometimes your trial lenses, trial frame will have a totally different on some curved trial frame, because once I found out that one refraction is doing the whole thing every day, patient coming back, we are searching and we are telling the refractions you do it properly. Finally we found that this was bent. So this is some small things sometimes will create lot of problems. High index lenses, we have to advise them for going for high refractive errors. We have to advise them for high index lenses. Anti-reflection coating, already has discussed about that thing. Finding the optical lenses, when the patient coming back with the problems, it is very important. You can use an experienced ophthalmologist or an optician can find it out very easily, but otherwise he can use the lensometer. Nowadays it's much easier. Um, as already discussed, we have different types of lenses, but whenever you have different type of lenses, when the patient is from monofocal to bifocal, you know that the patient comes back with a lot of complaints, and that you have to explain it. Progressive lenses, we should know what type of progressive lenses patient purchased, and we should explain to the patient also what is a progressive lenses. And even we can have a picture of like this, a picture in the OPD, so that we can tell that this is the area where you can see that this is a reason by which you are taking more time to adjust it. So best candidates for progressive lenses: previous progressive lens wearers, first time users of progressive lenses, highly motivated patients. And difficult people, high add. When some patients are having a +1 power addition, and when you are changing it to +2, immediately they will go and tell me, I was using progressive lenses, but now I am having problem. So you have to explain them. When there is a high add, you will take some time to get adjusted. When they were using wide segment bifocals and above 60 people, when first time they start using, they will have a lot of problems. Selecting the frame also already explained, you should not select a very small frame progressive lenses. And these are the few aspects we have to think in every case of spectacle intolerance. You are all aware of the pantoscopic tilt. It refers to the frame alignment in the up and down position of the frame. The pantoscopic means the lens bottom is rotated towards the cheeks. Rotoscopic means in the other way around. So you should have a proper pantoscopic tilt. And when the lens is having a proper pantoscopic tilt, this measurement is okay. But some patients will have a ear positions little upwards or little downwards. So you will check it, everything is correct. Patient will come back and will tell that I have a problem. So check it whether when you are wearing the glass, whether this regular pantoscopic tilt is going to change or not. So ear position is also a important things, because if the pantoscopic tilt is not proper, the patient cannot see in the downwards. So if a patient progressively used patient is changing to another frame, if the tilt is not correct, patient don't adapt it. He will go on coming back and telling you that. So you have to really check whether this pantoscopic tilt is correct. And of course the vertex distance, that is very important about the high power lenses. If it is much anterior, his field will be reduced. So you have to measure the vertex distance in all these cases, and you have to teach your optician also, because if you are having an optical shop, you have to teach that, because once you teach him very well, then it reduces a lot of your problems. So you have to be very careful about all these things. Then again the other curvature, the face form wrap, that is, you have to have the vertical this thing as well as the horizontal one of the frame. If the frame is so flat, the patient will have a lot of problems. So it should be with the curvature of the face. So some frames the patient will like it, but when they start using, they will come back and will complain that this is not suitable for them. If you are not identifying the problem, the patient will go on coming back. So you have to advise them. The patient should have, when you are looking towards the side, actually if it is very straight, the patient's vertex distance is going to change it. So you have to identify this situation. Then fitting, actually there are a lot of computerized systems. This is one of the SLRs, Visio Office systems, so that you can take every measurement of this, like a face RAM, everything you can measure it, and you fit it properly, then the complaints will be reduced. So effect of incorrect PD difference in bifocal, it will be little less, but if it is a progressive, it will be much more. Residual cylinder power also the same. And again the addition, as I mentioned earlier, this is the problem is already discussed by the Dr. Andrews. Suppose the patient previously was using a soft design, and patient want to reduce the price and they have selected a hard design of a progressive lenses, he will go on complain that I was used with this progressive lenses and the present progressive lenses I am not able to adjust it. So he was used with a soft design. So you have to identify what design he is using. Sometimes he will go for a cheaper version and he will have a lot of problem in that. So correction of astigmatism, again everything has to be correct. Children can tolerate high cylinders, they can tolerate to very good extent, but as the patient goes older and older, they won't tolerate even small changes. Anisometropy and anisoconia, you have to be very careful. I am not going to the details of that thing, it's everyone is aware of that thing. And main thing is your progressive lens troubleshooting. When the wearer present with the complaints of vision, eyeglass should be carefully evaluated. Verify refraction, verify add power, verify everything again. Prism, whether there is a fitting highs, pupillary center, IPDs, verify monocular or pupillary distances. Sometimes the patient will have an facial asymmetry. So some patients will have a marked asymmetry of the face, and that cases the centering of the progressive lenses will be a problem. So you have to take the measurement very accurately with the frame. So our responsibility is do not change the glass unless the patient is having a remarkable thing changes, and if he is not willing to change it, you change it, mostly the patient will come back with all sorts of problems. You discuss with the patient, then only change it. Give the same base curve as before. So you have to instruct. There are, you go on only prescribing the thing, you have to learn lot of other things. Stiffer base curve or lash clearance to be avoided as it will cause image magnification, and high minus specify to the patient that you have to go and buy a high index lenses, otherwise he is going to come back. Avoid very large frames also. So proper counseling is a very important thing. Most of the time we just prescribe it. Progressive lenses, you have to explain before patient purchases the glasses, these are the problems he is going to face it. Then you can avoid a lot of complaints. And never assume a hostile attitude to the patient, because sometimes the patient comes and tell you that I have problems, and most of the time he will be right. This is our tendency to tell that you will adjust it everything. Don't take it that way. You check it, he will have a problem. So thank you for your kind here.